How to manage 8 subjects in BDS final year. Final year of BDS is difficult and yet the only time you actually learn a bit about dentistry. It's your sneak peek into actual dentistry. It's difficult, not impossible. So make the most out of it. Read a subject well during your clinical posting. The best time to learn is when you can correlate theory and practical. If you are in OMR, you often see lichen planus and leukoplakia. Go back to your room and read. Discuss the case with your staff friends the next day. You won't forget it. The theory of OMR is difficult, more so if you're not well versed with oral pathology. So you will have to make notes, read and reread. This will also prepare a part of oral surgery for you. Read White and Ferro, at least the first few chapters for radio. During the year, read foreign authors, understand the concepts, and then you can either switch to notes or Indian authors for exams. The truth is, you have to read foreign authors to understand, but exam pattern requires you to put together your answers just like Indian authors' books are. Hoons is a decent book for OMR. Perio read Carranza's 9th edition, not 10th, not 11th, 9th for normals. The rest of the things from the latest edition should be okay. Read each and every word of it. Once you understand the normals of gingiva, you can build on them for the rest of it. Read both Chantipriya Reddy and Carranza. Make notes. Perio is a very interesting subject to read. While in clinics, learn about instruments, their grasps, history taking, different phases of treatment, route planning, curettage. If you have postgraduates around, you might be lucky to witness some surgeries as well. If you do, read then and there. Reverse bevel, external bevel, internal bevel and so on. Clear your concepts. Endo. Ingalls 5th edition for instruments, access opening, BMP and obturation. There are some beautifully drawn diagrams, very easy to understand. The best would be to take extracted teeth and do the things simultaneously. It will be interesting and you will never forget. Irrigants from Grossman, calcium hydroxide, weeping canals can come as short notes. Conservative dentistry. Basics from Sturdivant and later you can shift to Ramya Raghu. If nothing else, read composites from Sturdivant. Ortho. Balaji should be enough, but you can add to your understanding by doing model analysis on study models, each one that's in your book, self-analysis. This way you will not only get to experience but also remember all the points. Try to find some videos online. You have to imagine ortho like Lego. Move the blocks here and there to achieve desired results. There is this book called Rakosi Diagnosis. If you can catch hold of it, it will teach you good history taking. You could actually play an ortho game too. Make people stand, remove them to create space, close space and align. Just imagine all this in your head. Read serial extractions, space maintainers, development of occlusion, maxilla, mandible of pedo 2 in this. Pedo. While you think pedo and endo are similar, they are not. I have many UGs asking me if I will obturate after pulpotomy. So if nothing, make sure you know the difference between pulpectomy, pulpotomy and apexification. Read about sealants, PRR and stainless steel crowns as well. Observe your staff while they're working on patients. You will learn a great deal about behavior management and child psychology. But that part anyway, you will have to mug. You can pick up Shobha Tandon or Nikhil Marwa. Prostho. The mother of all evil. RPD Stewart, MC Kraken. Take casts from your department and apply your knowledge. Try to design RPDs yourself. You will learn the most this way. FPD Rosensteel is a beautiful book. The charts and tables are also nice. CD Nallaswamy. Read, make notes, read again and again. PhD. Fluorides. School health programs. Epidemiology. Indices. If you can cram all this up, you'll pass and no need to look beyond Soban Peter. Final year in BDS is the most important year as it deals with all the clinical subjects and their applications. And yes, attending lectures regularly is also beneficial. It will help you in better remembering of the subject. All the best. Hope this was helpful.